So welcome to this session. What we are looking at is what we call community organization. In this module, we'll look at the dynamics uh, in community mobilization and community organization. So this is a session that basically puts the concept of community in the perspective of public health, and basically why we can look at public health problems with the lenses of communities. So in this session, we are going to look at what communities are, why it is very important to involve communities, and what are the dynamics or the issues in community organization. I start this presentation by bringing the definition of public health. Public health is a discipline that has been defined in several ways. And in me bringing these definitions that I have here, I want to emphasize the issue to do with community. Okay, so the IOM definition of public health is that it is the science and art of preventing disease, prolonging life, and promoting health through organized efforts of society. Several modifications of these definitions have been that they replace the word society with the word community efforts through organized community efforts. Some of the definitions bring that out. That the word society in itself is recognizing that these efforts, public health efforts, are to do with a certain group of people that have to work collaboratively in an organized way to bring about prevention of diseases, prolonging life, and also promotion of health. The other definition that I have here is that public health is the science of protecting and improving the health of people and their communities. So you can see that the word community is also basically coming in here. So the whole thing is that it is very hard to define public health without referring to groups of people. We often call these groups of people populations. So you find out that in definitions of public health, you will have the word communities, you can have society, and then you can also have populations. Okay, the emphasis here is that people are always interconnected. Okay, and public health is focused on ensuring that the efforts of these communities can be harnessed, that we can have greater impact if we work with communities, with populations, or with societies. So having known that in the definition of public health is often it's often explicit or implicit that the concept of community is brought in. So what is this term community? So here I have several definitions. The first one is that community is a group of people with shared values, geography, functions, and interests. Okay. The most commonly used definition of community is one that encompasses an issue to do with people being in the same geographical location. Okay, but that is not the only dimension that we look at. You can still have a community of people who are living across different continents but they still form what we call communities. And that's why the first definition that has issues to do with shared values, functions, and interests is actually very important. Okay, so communities can also be defined apart from using geographical dimensions, values, or interests. You can still look at culture, occupation, just like this WHO definition of community. It still looks at culture, values, norms, and a commitment to mutual needs. Okay. Yeah. If you look at how the communities where we basically come from, you realize that people within a particular community actually interact. People don't live in isolation. So that means that as you engage in public health interventions, you can use community interactions as a tool. Okay, and this is where the concept of word of mouth actually becomes very important. That because people interact, information usually spreads very fast in particular communities, and therefore you can use these community interactions as a tool to effect change or to cause change, or basically mobilize people such that they can take collective action. Now we come to the term community organization. One of the first things that you really need to know is that communities are actually resourceful. If you organize them, we are going to define the word community organization, but if you mobilize the different resources that communities have, it is possible that you can cause changes in health or in public health or community health. So that means that as a public health professional, you need to have the tools and the skills, the knowledge and competences to be able to look at a community and identify the challenges that this community are facing, and then organize these communities to take action such that there is a positive outcome out of their efforts, organized efforts that I talked about. But of course, in moving, you're basically assisting and supporting or even guiding the community towards that journey of creating that change. Okay, and therefore you actually help them in making certain decisions. Okay, so community organization is a concept that involves identifying problems, taking collective action, and supporting community decisions. You can also define it as a process that helps people address obstacles, develop capacities, and realize their potential. You can also look at it as the social development approach that empowers the marginalized. So the overall concept here is that communities face different challenges. Often, if you don't have this community brought together such that they can work collectively to address their challenges, then you will find out that the community challenges will continue to exist without being addressed. So community organization basically bridges that gap, that you have a situation A and you need to move to a situation B. Across that journey of moving from one situation to another situation, which is better, involves a lot of activities. Of course, you need to identify what the problems are, what are the potential solutions, and how do you mobilize the different resources to make sure that the solutions are put into action, what we call the collective action. So that is the concept to do with community organization. So the whole point is that working cohesively is very important to create systematic change. This is to say that if you actually want to effect change, or that you can basically call reform or a systematic reform, you need to work collectively. And that's the first point, that the emphasis is on collective power. It could be hard for you to effect systematic reforms without involving the community as a whole, utilizing their potentials, their resources, or basically empowering them to create that change that is actually desired. Okay. Often community organization is used actually in confronting societal issues. We have a number of societal issues: gender-based violence, which of course involves a number of different forms. It has different forms, but also you have communities or groups of individuals that are actually marginalized. Okay, of course, this can include women. This can include children. This can include refugees. This can include immigrants. So these groups of individuals face unique challenges, and these challenges have been in existence for over several decades. So that means that these are actually historic inequalities. Okay, you can also term them as historic inequities, that when it comes to the decisions that uplift all community members, these people are always lagging behind. Their issues are not often tackled. So for you to cause a systematic change that will result into transformation or into reduction of these inequities, it requires you to employ community organization. And that is why we are saying that community organization and building are very, very instrumental in addressing these inequities or challenges, fostering what we are terming as systemic change. Okay, so still again, the emphasis is that identifying community challenges, and then looking at the options that you have to address the challenge based on the resources that you have. And in here, these resources are the ones that we are terming as assets. And then the other thing is, having looked at what you have, what are you choosing to undertake? Okay, what are the issues that you're actually prioritizing, and then build enough community power to create that change. The point is that emphasis is on empowering communities. If you don't empower communities, then the chances of achieving sustainability becomes very, very hard. Okay, so empowerment is very key, empowering communities, and starting with the most pressing issues, what we are terming as relevant issues, and also critical reflection. So always remember that communities will always exist, and communities can never actually be separated by just geographical barrier, because we have what we call online communities, we have different communities that are connected by internet. So the interconnection, people basically are interconnected. And that's why we are basically saying that community interconnectedness is actually very important, because human beings are always looking for where they belong. That sense of belonging is one of the things that humans actually need. And therefore, if you have communities that are closely connected, usually these communities are actually associated with better health outcomes. So that means that if you have a community that is not connected, they are likely to have poor health outcomes, what we are terming as negative health outcomes. It's just like when you look at homesteads where you have people living lonely, the chances that they can actually die without anyone noticing are actually very high. So having communities is very important, because each of the members of these committees is actually responsible for the other. Okay, that means that social support system is very important in producing positive health outcomes. And therefore, in situations where you have community connectedness, you will have reduced deaths associated with drug overdose, reduced deaths from suicide, and then also reduced cases of poor mental health. Okay, so that means that being interconnected is actually very important. I've had stories of people that are staying in refugee camps, and then relatives suggest that they can be moved away from the refugee camps to be taken to decent places, often urban areas. And these people actually refuse. They refuse to move to urban areas, regardless of the amenities that you find, the electricity, the good food, the nice, everything that is actually what you can find in a decent urban home. Compare that with the situation in the refugee camp, for example. The reason as to why these people actually refuse to move away from the refugee camps is because they have created social networks. They have created social connections. So they don't want to move away from that kind of social support or community connectedness, because they have formed bonds with let us say, the community leaders. They have formed bonds with the church members. They are involved in circles. They are involved in a number of communities that a number of groups that bring people together. So you don't. They end up not wanting to get out of that kind of social setting. Okay, and often those that are actually forcefully brought to urban areas, they end up being depressed, and some of them actually don't last longer, because these are usually elderly individuals, and when you actually isolate them, it's like you're fastening their death. So building communities is very important, because as practitioners, you'll actually be engaged with the community as a whole. And remember, a community has different dynamics. There are different power plays, there are different factors, and it means that you need to know the influence of all these different dynamics on whether actually you'll be able to effectively cause social change. Okay, so that means that community building is very, very important. Said earlier on, a community organization is very important in tackling problems that have always existed in different communities. So social health inequalities and health inequities are issues that community organization can help in addressing. Yeah, so what we are basically saying here is that as a public health professional, you will be involved in community organization activities. It's very important that you build a very strong professional career that will give you the credibility that you want. That credibility, of course, is built over time. The committee members need to look at you as a credible person that they can rally behind to cause the change that you desire and what the change that actually the community also desires. So if you build this credibility, it means that you can be able to work with everyone within the community in order to achieve better health outcomes. Engagement with grassroots members of the community is also very important. We have a concept to do with health in all policies approach. This concept rotates around the fact that it is very important to consider also other sectors when dealing with health policies. Remember that health impacts different sectors, but also different sectors also impact on health. So that means that it's very important for you to look at how health policies can influence the other sectors of education, agriculture, transportation, and financial systems, but also how those sectors actually impact on health outcomes. That means that if you have the intention of building healthy communities, it is very important to always think about how the other policies are impacting on health and also how health policies are impacting on other sectors. To address local challenges, it means that you need to build a very strong community and strengthen, build strong communities and actually also strengthen them holistically. This is to basically say that if you're addressing particular community challenges, it's very important that you don't look at these challenges in isolation. Looking at them holistically gives you a good standing in actually achieving what you want. Okay, because usually if you look at problems in an isolated manner, you will not understand the causal relationships. Okay, this is to say that if you have the idea that A causes B, so let us address A. What you perhaps will forget is that yes, as you're addressing A, you're creating another problem C. So that's why it is very important to look at problems holistically. Okay, local participation in policy making is what I've just explained in terms of having health in all policies. Okay, and also it is very important to be able to identify the marginalized communities and be able to point out the health challenges that they actually face and be able to address them. While working in the community, you not work alone because health problems are actually are cutting across different sectors, like what I've just said. So that means that you can have a health problem that needs the attention of, let us say, teachers, let us say, community leaders, let us say, different community-based organizations, and many other things. It is therefore very important to always look for potential areas of collaboration with other stakeholders. How do we address community challenges? What approaches do we use in community organization? You can focus on creating what we call social reform, improving societal conditions and supporting development programs. That can be an approach that you can use. The second one is social action, which is about understanding the power dynamics and creating power dynamic changes that can result into proper allocation and distribution of resources. And this usually involves issues to do with advocacy, elections, and networking. Basically, if you have a community that is not thriving, where you're having certain individuals being marginalized, so for you to improve the social standing of these marginalized individuals, it could involve making sure that there is advocacy that can create laws that can result into uplifting the different members of the marginalized groups. But also elections. We have situations where women are not actually allowed to participate in elections. But we also have issues to do with affirmative action, where, for example, women are allocated positions of leadership to be able to act as agents of change that can create what we call social action. And then the third is locality development. This one is aimed at self-help and integration of community groups and fostering communication and consensus. And then societal planning. This one involves problem solving through rational decision making. So that means that members of a particular community actually sit down, analyze the issues, and then may come up with rational decisions that can help in addressing the challenges. Okay, that marks the end of this presentation. Thank you.